One of the things that I got really early on in my practicing career and getting into TMJ and beyond TMJ was the whole idea of stress as it relates to the rest of the system. What would happen was I'd have patients who come in and they'd say, "Oh, I've been to see the doctor and the doctor's told me I suffer from stress." And I go, "Yeah, okay, well you can remember this is 30 plus years ago when stress was had a bit of a stigma. You know, you're going to go off to the funny farm, or you know, you couldn't cope with life or whatever it happened to be." And I thought, now hang on, let's find out what stress really is. And Hans Selye, who was an Austrian-Canadian, Austrian-Hungarian endocrinologist, said stress is the non-specific reaction of the body to any demand placed upon it. So you place a demand on the body, it will react. So for those people who get head, neck and back pain, we look at the mouth and say, is this a stressor? Is something going on here that's causing stress within the system? So what I wanted to do was I wanted to give to my patients something that they could take away, which is this book, that talks about what Selye said, and then looks at the different practitioners and the things that they can do to help people move through whatever it happens to be. From my arena. So I wrote this purely and simply as a let's get the information out there, let's get it out in an easy to read format, let's use my dubious sense of humour to really get the message across and help people understand what's going on with them and understand that there's nothing wrong with a body that's stressed out. We're all moving so fast at the moment, you know, we're not really meant to move this fast, and we need to do something about that. And some of those things are very simple. You can just get in and say, look, we need to change that. I'll give you a good example of this. I had a patient who came and he was about to get married. This is a few years ago in England. He was about to get married, and the week before he got married, he got Bell's palsy, paralysis whole one side of his face. Anyway, so his friend rang me and said, "Bill, can you do anything about this Bell's palsy?" I said, "I have no idea. Send him on down." And because his fiance said, "We are not going down the aisle with you with one side of your face paralysed," which was a bit mean, but that's the way it is. So anyway, I said, "Yeah, sure, send him down." And all that had happened was a week earlier, he'd had a filling done and the filling was too high. All I did was adjust the filling. Within 24 hours, his Bell's palsy went away. Now, I wish all Bell's palsy went away that quickly, but it shows you the impact of the stress of the mouth on the rest of the system. And that was really, for me, it just compounds and really shows you what wonderful things we can do in dentistry to really help people, to really move them through from where they are. Yeah, of course we're here to do preventative dentistry. Of course we're here to make sure that their mouths are nice, clean and tidy. We're looking at systemic illnesses. We're looking at the link between gum disease and heart disease, diabetes, cancer, stroke, preterm low weight babies. All those things are really, really important and they form part of what I do. But when you can take somebody, you go, okay, fine, I can see your problem. You've had headaches for 20 years. Let's deal with that. And let's see if we can change that. That's the beauty, the power, the joy, the excitement of the sort of dentistry that I practice on a day-to-day basis.